Dr. Ali, our audience has been sending us questions about symptoms associated with this time of life, many of which you've mentioned, but also weight fluctuations, hair loss, not feeling like yourself, loss of sex drive, sort of on and on. So what are the best ways to sort of manage those, just as the sort of starting point, right?
Right. And, one of the challenges in this space is because there are so many different things going on. So for example, in our clinic, when a new patient comes in, we ask quite a bit of questions as far as like extensive evaluation of symptoms. And oftentimes we'll sort of break it down and look at, okay, for you in particular, what are the things that are bothering you the most at this moment? And really try to tackle those in a stepwise approach. Oftentimes that involves some kind of discussion about hormone therapy and what may be happening at this particular moment in that person's journey. And when we do that, often we will kind of, start with those first initial things, try to address those symptoms, and then maybe do a follow-up at a, 2-3 month interval, see where we are, and really kind of stepwise approach. The challenge of perimenopause is you can get things perfectly feeling great, and then in a few months, your body has sort of moved to the next phase of this, where we sort of have to keep working. And that's the challenge, but also it can be very certainly rewarding. And what surprises many women is that once you're actually on the other side where your ovulation and ovarian function has kind of quieted down, then it might be much easier to, keep up and manage because we don't have to account for that background change going on.